All right, welcome to my top 10 psych med reference. So this is just specific ones that I picked. You may choose different ones. This is just a resource that I made so that it was easier to kind of hone in on certain medications as a new grad, an easy reference to like medications that have more, bang for your buck, covers more symptoms, and ones that I really honed in on where I could know the side effects, I know the education on them, and just get really familiar. And so I suggest you doing this, picking 5 to 10 medications that you know really, really well that kind of have a broad range of symptom control, symptom management that you can be familiar with and comfortable with just to get started so that if someone comes in with depression and they haven't been on anything and you know that SSRI is good, well, which ones can you just pick up right away and give the education and look confident to the patient, right? And they can change over time, just like with all your resources. You could get new ones that you like, or as you use one specific med, maybe you find that it doesn't work as well in more patient cases that you're seeing, so you decide to switch to a different one. That's totally fine to do. So I included my top 10 that I have on my list and which symptoms they cover. I included this in the resources down here, and then attached to this PDF is also like a blank chart so you can add other medications if you want to. So the first one that I have on here is sertraline, which is Zoloft. So that's our SSRI. It can treat depression, anxiety, panic disorder, OCD, PTSD, social anxiety. With the OCD, it is going to be on the higher end dosing range. Sometimes with OCD, when you're using the SSRIs, you're going to use higher doses to manage them, okay? That's pretty typical. Favorable cardiac safety, flexible dosing, right? It goes from like 25 all the way up to like 200, so you have a really, really broad range. And then as well as it is safe in pregnancy, so that would be one of my top ones. As you can see, I kind of just colored the charts here. Remember, SSRIs are not good for bipolar. And if just a refresher, they can trigger mania. So if SSRIs are used as monotherapy for the treatment of bipolar, and which can happen too if you're not sure that they're bipolar and they're presenting as depressed, but you don't know the history of them having manic episodes, or maybe it's underlying, we can trigger that and you'll find out. You'll find out. Not to say that in some cases you can use SSRIs, but not as monotherapy. You're going to have to add also a mood stabilizer on the treatment regimen as well. All right. It doesn't treat ADHD by itself, sleep, or psychosis. But, once you treat their depression and anxiety, then in turn they probably will sleep better, right? So it doesn't treat it directly, but if you get the main thing under control, then your sleep, you should see some improvement in the sleep as well. The next one is another SSRI. So we have escitalopram, which is Lexapro. So this one is really usually pretty well tolerated as well. The reason why I have it in here is it has one of the least amount of interactions compared to some of the other SSRIs. For example, like Prozac has a long half-life, so if you were taking somebody off that one, you have to worry about it. It can be activating. Same thing with fluvoxamine, which is one that we use for mainly OCD, but that one has quite a few interactions. So out of the SSRIs, if I had, so this is my list, is like if I had only 10 psych meds that I could use forever and didn't have access to anything else, like my go-tos, okay? So my 2 SSRIs, sertraline, Lexapro, escitalopram, okay? With escitalopram, though, you do have less of a range that you can start at. You typically like 5 to 20 range for as far as dosing goes, so just be aware of that. Bupropion, Wellbutrin, love this medication, especially. So with my private practice, my focus is on young adult women. So a lot of times they're new to medications and they'll present as, that fatigue, that low energy, the low motivation. When you hear those in your chief complaint, it should trigger, Wellbutrin being a good one, because that's the main things that it works on is motivation, energy. It's really good for that. We can use it awfully well for ADHD as well. You might have seen that in your clinical practice. Sometimes if they're low energy, depressed, concentration issues, we can start off with Wellbutrin before starting a stimulant. It also is a good add-on. So some of your SSRIs do have that side effect of sexual dysfunction, which causes a lot of people to get off of that. That's one of the main reasons that they will get off of their SSRI, especially men, is because of the low libido. So what you can do is add Wellbutrin to the SSRI. So now you're treating the SSRI symptoms, and then the Wellbutrin is used as an adjunct specifically for the sexual side effects. Or you can switch and just have them on the Wellbutrin and they have that sexual dysfunction is not there, okay? Caution with it though, avoid with eating disorders because it does, one of the side effects or risks, it does lower the seizure threshold. So people who already have seizures, avoid. People who are detoxing from alcohol, also important to avoid. Sometimes that gets forgotten, especially if you're going to work in inpatient detox, which I used to work in for rounding. If somebody came in and they were there for detox and they also took Wellbutrin normally, we would actually hold the Wellbutrin until they were completely detoxed because of that risk of seizures, and it lowers that threshold. With the eating disorders, the reason why you want to avoid it as well is, again, with the seizures, when someone has eating disorder, specifically bulimia, they're going to have a ton of electrolyte imbalances, so it already puts them at risk. So be aware of that. But otherwise, if you just have someone low motivation, low mood, low energy, kind of that fogginess, kind of that feeling like they don't really want to get up and get going, Wellbutrin's an excellent one. It's one of my favorites, and I've seen really good effect with it. That being said, it's not good just for anxiety, because since it is activating, it gives you that energy. Someone who is already feeling that, a lot of anxiety, it shouldn't be used just to treat. And the same thing with when you're educating, make sure they take it early in the morning. Kind of, I would say somewhat, it's not a stimulant, but I would say the education kind of goes hand in hand with what you would tell someone for a stimulant. You know, take it early in the day. It can reduce appetite. So kind of monitor those kind of things because it is activating, okay? All right, then we got Effexor. So Effexor is good for, or venlafaxine is good for depression, anxiety, panic. It also helps with pain, chronic pain. So if you have someone that just happens to have chronic pain and they're depressed, this is a good one. The same thing with duloxetine. It's not on my list here, but it's also a good one. If you have someone that comes in, has chronic pain and also depressed, then that's a good one to choose, okay? So whenever you're picking your meds for a patient, try to, get comfortable and start looking at the whole picture, but not just their psych symptoms. What other things are going on that maybe you can use one med to address multiple symptoms or multiple things going on? So that's a good one. It is one of the harder ones to come off of. A lot of people have side effects, jitteriness, that kind of thing when you taper them off. So when you are taking someone off of that, make sure you're doing it slowly. Then we got Remeron. So the interesting thing about Remeron is that it actually has more side effects the lower the dose. So if you start someone off a low dose and they're experiencing side effects, you would think that it's the opposite, like with your other medications, right? But you actually would go up, and you should see a decrease in the side effects with the increase of the medication. This one is good for depression. It's good for sleep. It's good for appetite. It's appetite stimulating. So think if you have someone that's presenting as maybe a little on the thinner side. We use it a lot in the geriatric setting. When I worked in memory care, I was working as a nurse. I wasn't a prescriber, but they would add it on to some of the elderly people who were like failure to thrive. They weren't really eating. Some of the dementia patients, they would throw that in because it increases appetite. Okay, but on the flip side, if you have someone that's really weight conscious, trying to lose weight, it's one of those that I would not add on because it does increase appetite. Okay, so that one covers, you can use it for depression and sleep. So if you were gonna do Remeron at nighttime, okay. All right, moving to antipsychotics, aripiprazole, one of my favorites for sure. One of the reasons why I do like Abilify is because it comes in a long-acting injection form. So I use it a lot where I'm currently at in the SMI population. We use Abilify Maintena, and we also use Aristata, which comes from the aripiprazole as well. And I've just seen really good effects with it. The side effects, though, if they do experiencing it, the main one I've seen is like the akathisia. It's like this inner restlessness, which you can give propranolol to help kind of ease that agitation off. So it's good. Also, you can add it for someone who has depression and they're kind of having a little bit of that agitation stuff. If you add on like a low dose, it works really well too. So that's why you see it in this orange box here as an adjunct. And then bipolar psychosis as well. So the long-acting injectables, a lot of them are actually approved for both bipolar and schizophrenia because they both, when a patient's in that manic state, it is basically a psychosis. So it covers that, and I've just seen really good. So one of my top 10s if I only had a few to pick from. The other one is Seroquel. So Seroquel, look at how many boxes it covers, okay? The main downside of Seroquel, I'm sure you know, is it's also one that people gain weight on, so you definitely have to monitor it, but it does work well. That's the thing that you kind of fight in the SMI population, because you may have someone doing really well on it, but they're also gaining weight, so you have to kind of monitor and try to, you know, monitor that closely, make sure that they're not getting too much weight with the metabolic issues. So it covers bipolar, it covers, you add it on as low dose anxiety medication as well. Not first line for anxiety, but it does help. Like if you've tried, like, you know, you're trying everything. You've tried Visceral, even gabapentin, propranolol. It's just one of those, another one to have in your toolkit as an adjunct. It is sedating, so to, you know, take it at night. People could take it for sleep, psychosis. It helps with depression as well. So that's one of my favorites as well. Lamictal, lamotrigine here. I should have. Oh, okay, bipolar depression. I'm like, yeah, you could also add it in for regular depression as well, especially if they're having a little bit of that like more agitation with their depression, because it is a mood stabilizer. The thing with Lamictal, though, remember, we want to make sure we're watching out for that Stevens-Johnson syndrome. So always start very slow, monitor closely too. Don't try and speed up this tapering process because of that risk. Any sign of rash, immediately discontinue it. But, you know, minimal weight gain on here, and so it's a good one too, that works pretty well for bipolar depression and for maintenance. So one thing about this mood stabilizer against the other ones is Lamictal is good for maintenance of bipolar and bipolar depression, but not for acute mania. Okay, so your other mood stabilizers you can use for acute mania, so you know your lithium, your Depakote, Lamictal, lamotrigine, is good once they're stabilized. So maintenance and for depression, not for acute mania, okay? All right, so then psychosis. As an adjunct, you can add on also like that mood kind of portion. Then we got Vyvanse, lisdexamfetamine. So that's our stimulant for ADHD. Why I picked this one and why I like this one if I were to have only access to these and no other medications is because it's actually a prodrug. So what that means is that it gets metabolized in the body. So it has less abuse potential because of that. So say I wanted to abuse my stimulant and I want to snort, you know, people sometimes snort their Adderall or whatever. It actually won't be really effective because it needs to be metabolized within the body. So it's kind of like you wouldn't get that effect as you would with the other stimulants. It's a longer acting. You take it, and then once it's in that metabolism process is when it's activated. All right. And then the last one out of my 10 is Trazodone. So we use this a lot in inpatient for sleep. Usually if you work inpatient, you'll probably see that like on your standing order sheet for a PRN for sleep. So it also as an adjunct for depression. So, you know, if they're low mood, depressed, and having trouble sleeping, you can add like a PRN, like a 50 milligram Trazodone. All right, so those are my top 10. I added the reference there, so you can add yours. Feel free to use these ones that you get started. That way, you know, you have it in your binder. Someone comes in with depression, and it's a quick little cheat sheet here with some of my top ones. That way, you're not having to think of, oh, what are all the SSRIs? What are all the mood stabilizers? And you can kind of get your most bang for your buck here, okay? All right, so I hope that helped, and I will see you in the next video.